Hey, it's Ricky J again. All right, enough about me. Let's get started. A 2-day-old infant comes to the peds emergency department. He's cyanotic, he's irritable, he's in respiratory distress. We've got a blue baby on our hands, people. In the previous sketch, we covered the congenital heart defects that lead to left to right shunting. These often present with cyanosis later in life. A 2-day-old infant, though? It's time to think of all those congenital disorders that lead to early cyanosis. These are your right to left shunts, or as I like to call them, the terrible T's. Truncus arteriosus, transposition of the great arteries, tricuspid atresia, tetralogy of Fallot, and total anomalous pulmonary venous return. This will be taking place at a manga convention. You see, manga is read in the traditional Japanese style from right to left. How fitting. As you'll soon see, however, this is more than just a manga convention. It's a whole Japan con. We've got video games, anime, even VR. It's gonna be pretty rad. You know, what better way to show a blue baby than a little, well, blue baby? In right to left shunts, deoxygenated blood from the right heart is sent to the left heart and out to the circulation. This leads to a dusky blueness of the skin. Clinical consequences can be severe, and prompt surgical intervention is usually required. Maw, cheer up there, Do-Re baby. It'll be okay. Let's start with the first terrible T, truncus arteriosus. Instead of an aorta and pulmonary trunk, you're left with a single outflow tract for everything. That means oxygenated blood from the left ventricle and deoxygenated blood from the right ventricle mixed together, sending poorly oxygenated blood to both the pulmonary and systemic circuits. It's one single trunk, embodied here by the great big tree truncus. See how the red oxygenated roots combine with the blue deoxygenated roots, leading to a single outflow tract? Not good. Since both ventricles are dumping into one trunk, a VSD usually connects the two chambers, hence the V shape on his chest, torn open. To spot a truncus arteriosus, get a cardiac echo. You should see a common trunk overlying a VSD. Embryologically, what's happening here is a failure of septation. In other words, a septum usually forms to divide the truncus arteriosus into a right pulmonary tract and left aortic tract. It's the sequel we've all been waiting for. This requires proper neural crest cell migration, however. Let me show you what I mean. See that shield, or crest, if you will, held by that creepy goblin dude? The design depicts a cross-section of the developing embryo, and the neural crest cells, which develop from the embryonic ectoderm, are highlighted in red. Do you see it? The epidermis layer is at the very top of the shield, and the neural tube is that ominous eye shape. The neural crest cells sit right in between. The red arrows down each side of the crest indicate the migration of neural crest cells as they go on to form various cell types. This includes the cells responsible for proper septation of the truncus arteriosus. Failure of neural crest cell migration is associated specifically with 22q11 deletions. That means the Q11 region located on chromosome 22. See the numbers 22 and 11 incorporated into his helmet? 22q11 deletions will pop up whenever we discuss cardiac malformations that lead to conotruncal abnormalities. In other words, congenital syndromes that involve malformation of the aortic outflow tract. 22q11 deletions also lead to improper development of the third and fourth branchial arches, leading to all kinds of weird immune system stuff. We'll discuss this further in our video covering DeGeorge syndrome. On to the next congenital malformation. Let's keep that terrible T's mnemonic going with transposition of the great arteries. It'll be depicted here at the Monster Trainer station. Monster Trainer is a Japanese card game sensation that has taken the world by storm. The rules are simple. Transposition of the great arteries means that the great arteries, in other words, the aorta and pulmonary artery, are transposed, or opposite of where they should be. So your right ventricle dumps blood into the aorta instead of the lungs. Eventually, all that blood ends up in the right heart all over again. It's a closed circuit, mirroring what's happening on the left side. The left ventricle pumps blood into the pulmonary circuit, which drains into the left ventricle again, and the cycle repeats. Take a look at the tournament brackets on the back wall. This means two completely separate parallel circuits, red and blue. Oxygenated blood stuck on the left and unoxygenated blood stuck on the right. The result? A blue baby. Transposition of the great arteries is incompatible with life without a VSD, ASD, or PDA. You need some kind of connection between the two circuits. And if you look at the final matchup there on the back wall, that's exactly where the two circuits meet. The front is purple, to remind you of oxygenated and deoxygenated blood mixing. On the test, remember those murmurs that are associated with each of these defects. A machine-like murmur for PDA, a hollow systolic murmur for VSD, and a systolic murmur with widely split S2 for ASD. Gotta hear them all, or at least one of them. So listen carefully. These neonates turn cyanotic within a few days of life when the PFO and PDA begin to close, and that means it's time for emergency surgery. Like the rest of the cardiac malformations covered in this sketch, transposition can be seen on cardiac echo. The aorta will be sitting anterior to the pulmonary artery. Normally it's posterior. This is depicted by the mascot's red ponytail sticking up in front of the blue pulmonary ponytail. Chest X-ray might give you a hint as well. Transposition of the great arteries classically shows up as an egg on a string. In other words, the heart is kind of bulbous and eggy shaped. Just think of this monster trainer yo-yo on a string. Development of transposition in the fetus is also associated with diabetes in the mother. It's a classic risk factor. So let that glucose fly. The embryological misstep here involves spiraling, and that's why we've shown the spiral monster losing the battle. You see, septation is not the only step necessary for the development of the aortic and pulmonary tracts. To orient properly, it also needs to spiral. If the aortico-pulmonary septum develops linearly rather than spiraling, the aorta becomes anteriorly displaced and connected to the right ventricle. All right. The next terrible T malformation is tricuspid atresia. At Sketchy, whenever we talk about that tricuspid valve, look for those three peaks. This time incorporated into the hair of this cosplayer in the front here. He went all in this year. Atresia means that the tricuspid valve is underdeveloped. Not good. Now, the right atrium has no outlet, and all that venous return to the right heart gets stuck there. These hearts usually have an associated ASD, so blood can get to the left side. At Sketchy, the atrium is represented by a window, so an ASD is a hole in that window. Just like on the cover of the newest edition of the Dragon Ball Atresia manga. The thing is, this now means that deoxygenated blood from the right is shunted to the left. So now you've got a cyanotic baby. Next on the list is another T, tetralogy of Fallot, represented here by the tetrasalers. Oh, come on. You must have heard of the tetrasalers. Okay, so it's a shoujo manga from the 90s, and there are 4 of them, and they're schoolgirls, but they're really mystical guardians on a quest to find this artifact thingy. You look lost. Let me break it down for you. Tetralogy of Fallot is the most common of the right to left shunts, and it involves a tetrad of mutations. You've got pulmonary valve stenosis, right ventricular hypertrophy, overriding aorta, and a VSD. Each will be represented by one of the tetrasalers in action as they channel the power of the 4 elements: earth, wind, fire, water. And together, we are the tetrasalers. Okay, I'm done. Let's start with pulmonary valve stenosis. She's the elemental earth sailor, emblazoned with our recurring pulmonary tree symbol. As she gets choked to death by that evil sorceress, think of a stenotic pulmonary valve. It's this valve that dictates the severity of the disease. You see, if the pulmonary valve is significantly stenosed, it's going to be difficult for the low-pressure right ventricle to get blood into that pulmonary circulation. So instead, blood gets diverted to the left heart through a ventricular septal defect and straight to the systemic circulation. And that means a cyanotic baby. See that blue face? Sailor water to the rescue! Because the right ventricle has to work so hard to push blood through that stenotic pulmonary valve, it becomes hypertrophied. The water sailor depicts right ventricular hypertrophy in a couple of ways. First of all, we've included our recurring concentrically hypertrophied conch shell. That spiral shape should remind you of sarcomeres adding on top of each other in the setting of pressure overload, leading to a thickened, hypertrophied wall. All this ventricular hypertrophy can be picked up on chest X-ray. It's described as a boot-shaped heart. Hence those absurdly large, yet surprisingly waterproof boots she's wearing. All right, so we have pulmonary stenosis and right ventricular hypertrophy. Our next sailor will represent a ventricular septal defect. She's the fire sailor and the hothead of the bunch. If you take a close look at her costume, we've incorporated our recurring symbol for VSD, a big V on the chest. Remember, the blood that has a hard time cramming through that stenotic pulmonary valve is shunted instead through a VSD into the left ventricle. And it's time to introduce the last of the tetrasailors, the air sailor. See that red aortic arch of hair? As she flies overhead, she represents what's called an overriding aorta, which means that the aorta is located more centrally than usual, lying over the VSD rather than over the left ventricle. Much like truncus arteriosus, the malformations associated with tetralogy of Fallot are highly associated with 22q11 chromosomal microdeletions. So, just like with truncus arteriosus, we've incorporated the numbers 22 and 11 into her costume. Remember, they may be fighting evil by moonlight, but they're winning love by daylight. So, they gotta look good. 22q11 deletion leads to failure of neural crest cell migration. So, we've brought back that eerie neural crest as well. The area in red depicts the neural crest cells, and the arrows down the side of the shield indicate their migration to form various cell types in the developing embryo. A couple clinical findings to mention. On cardiac exam, take a good listen. You should be able to hear that stenotic pulmonary valve causing a harsh systolic crescendo-decrescendo murmur. Whenever we talk about a systolic murmur specifically, look for that systolic spray. Man, that pulmonary valve is not looking good up there. Remember, the degree of pulmonary stenosis is really what's dictating the clinical picture here. Children with severe obstruction typically present immediately with profound cyanosis. Children with moderate obstruction, on the other hand, may only receive a full tetralogy workup after that systolic murmur is incidentally noticed on exam. Otherwise, they're doing just fine. Every once in a while, however, these children may also present with hypercyanotic spells, also called TET spells. Pay attention to that spell the evil sorceress is casting. See how the water sailor ducks out of the way and summons that stream of water in front of her? She's depicting the maneuver that tetralogy of Fallot kids perform to help improve their cyanosis. When a TET spell occurs, the kids will squat, or, if it's happening in an infant, it might be up to the mom to fold the baby into what's called knee-to-chest position. What both of these maneuvers do is increase systemic vascular resistance. So more blood is forced up through that stenotic pulmonary valve instead of out to the body. I want you to think of our crouching water sailor here, dodging that TET spell with the knee-to-chest maneuver and responding by sending a jet of fluid upwards. Think of all that blood being forced up through that stenotic pulmonary valve. This way, more blood can get oxygenated, thus correcting the acute hypoxemia. Okay, on to our fifth and last right-to-left shunt. Like the others, it's a terrible T. Total anomalous pulmonary venous return. Usually abbreviated TAPVR. Wait, TAPVR or TAPVR? The newest dance and rhythm and tap game from Kanjanami. Psh, thought dance and rhythm games were passé. Not in VR. In patients with TAPVR, the pulmonary venous return is anomalous. In other words, all 4 pulmonary veins drain into the right heart instead of the left heart. Take a look at the screen. He's hitting right down, over and over again. This is to remind you that oxygenated blood is trapped on that right side. Blood reaches the right heart, gets pumped into the lungs, and then back to the right it goes. Because the right atrium is receiving blood from both the pulmonary and systemic venous systems, both the right atrium and ventricle become dilated. Kind of like our dilated, chubby, and overwhelmed tap dancer here. The left heart kind of sits there unoxygenated. Game over. Babies with TAPVR must have an ASD in order for some oxygenated blood to make it into the left side of the heart. A little opening, like the one shown here, in between the dancing stages. However, this blood is mixed in the right atrium with deoxygenated blood, and this leads to cyanosis in the newborn. These babies need urgent surgery. All right, we're done with the right to left shunts. But I want to throw in one more cardiac malformation called Epstein's anomaly. It's not a true shunt, but it does present in infancy with cyanosis. So let's head upstairs. That's right, Epstein's is upstairs. Also, take a close look at the convention center map. On the right side of the map, the patient's right, that is, the atria is emphasized. Not only that, it looks much bigger compared to the left atrium chamber. The abnormal dilation of the right atrium into the ventricle below is called atrialization of the right ventricle. And it's evoked by the phrase special event in the atrium. The atrium is overexpanded, and the tricuspid valve is displaced inferiorly into the right ventricle. The tricuspid valve is also malformed and doesn't function very well, leading to severe tricuspid regurgitation. See all that regurg up there on the escalator? Right on that tricuspid cosplayer, coming straight at him like a Kamehameha wave. Just unfortunate timing, really. All this backwards flow and regurg leads to right heart failure, hence the floppy, failing heart balloons up on the ceiling, left over from countless past conventions. Epstein's anomaly is caused by exposure to lithium in utero, which can occur if the mother is taking lithium to treat bipolar disorder. At Sketchy, lithium is symbolized by some kind of lift. Think lithium liftium. Just think of this escalator lifting our pregnant convention attendee here to the special atrial event above. And that's it. As we take in the entire sketch, remember that the terrible T's are right to left shunts that cause immediate cyanosis in the newborn. For a little memory device to recall each malformation in order, just think of 1 through 5. 1, common truncus. 2, transposed great arteries. 3, for tricuspid atresia. 4, malformations in tetralogy of Fallot. And 5 letters in Tapver. And as Link from The Legend of Zelda once said,